You may or may not, got it. You may or may not recognize me. My name is Charlotte. I go by she, her pronouns. I am the new co-chair for the Oregon Alliance, and I'm really, really honored to be here with you all. Yali wanted to share her regrets for not being able to attend today. She will definitely be missed, and I have some pretty ginormous shoes to fill, so I always appreciate a little bit of grace. Again, thank you for coming. As many of you may have heard me say, there are lots of us sitting in the room today, and that's beautiful to see. We had about 90 people register for today's meeting, which is amazing. And again, we have lots of not great colds going around Oregon. So especially with the number of individuals sick, it's really encouraging to still see all of you at the table and overall see that level of interest and engagement around the state in suicide prevention and the work of the Alliance. And as Annette said, it really has spread the wealth in this virtual world. So still be sure to take care of yourselves, grab your coffee. If you have a bagel at home, which I don't, so I'm a little bit jealous of that, grab one of those too. For how many of you is this your first Alliance meeting? Feel free to use your little reactions or unmute and say hi. I'd love to hear people bring their voices into the space. It's always wonderful.
Hi, good morning. It's my first Alliance meeting. I'm Julian.
Welcome, Julian. Thank you. Vivian, thank you.
Thank you. Hi.
Yes. Do you have your James? Do you have your hand up to ask something, or are you saying, "Hey, I'm"?
Oh, hey, it's my first time here, so
Perfect.
I'm James. Yeah.
Awesome. Thanks for coming, James.
Hi, I'm Sky. I work with Matchstick Consulting. It's my first time here.
Hi, Sky. Thank you. I just love hearing other voices come into meeting space. Whenever I'm doing one of these, I get real tired of my own voice really quick. So I love it. Thank you for sharing. And thank you everyone who is joining us today. I went against the you can chat in the little chat area because I really wanted to hear your voices. So there you go. I'm hoping a couple of us can volunteer and get us started in today's meeting by reading our vision and equity statement. Oh, Annette doesn't have it up yet. I jumped ahead. Never mind. We'll move forward. All right. So just to kind of look at the big view, as many of you know, the Alliance was established in 2016 to advise the Oregon Health Authority on matters related to youth and young adult suicide with a focus on system and policy advocacy. We have 50 voting members whose names you'll see on the screen when we vote, but all of you are welcome here in our communities and advisory committees. We love it, so please pop into those things, check it out if you're interested. You can contact Annette or Jen, and their emails will be added as well if you'd like to get more involved. We also really want to encourage you to connect with your local suicide prevention coalitions to bring this work of hope, help, and healing to your home community. Just a quick review. Our last meeting, Jen provided an overview of our work towards centering lived experience perspectives and feedback from our satisfactory survey, requesting better transparency about Alliance work in progress and more time and quarterlies for discussion. So since our last meeting, Jen Fraga has had a beautiful baby girl, and she is gorgeous, and will return to work very soon. I know we all miss her. We learned about the LGBTQ plus advisory school board testimony kit, which can be found on our website and has a series of fascinating presentations from we've had a series of really good presentations from programs doing suicide prevention in schools, including an update from Addie's Act from Claire, news on OHA and UO research practice partnerships on Addie's Act implementation in 7 schools. Jill gave an overview of the significant progress made in the first year of the new YSIP, and an update from Always Inspiring Sources of Strength. So great work happening. A little bit of a preview for today. Today we'll be hearing from Jill Baker about updates on the YSIP based on feedback from the Alliance and many, many more. The YSEP is what operationalizes the many big ideas that we talk about, and we will be updated annually to reflect current realities. Today, we'll be hearing from OHA Public Health about the complex intersections of substance use, abuse, and suicide, and receive an overview of groundbreaking research efforts in Oregon schools and continuing our ongoing work to ground our work in an approach that promotes equity. Before all of that, we'll break into some very small groups for introductions. So now that we're virtual, as I asked you all to bring your voices into this space because it gets kind of lonely, it can be difficult to have those informal communications, create community, learn about each other that we're sitting in this space with. So each time we meet, we want to provide some opportunities for that connection. When we return from the small groups, we'll pause to approve minutes and vote on a nominee for the executive committee's lived experience position that recently opened. So some just quick instructions for the small groups. We'll break out for about 4 minutes. So this is a speed intro. Please introduce yourself, your name, your pronoun, role, and share one thing about yourself that might surprise someone. So I think Maria is going to get ready to send us off into our happy talk space where we can hear each other's voices. Thank you, by the way, Maria, for organizing all of that, because as someone who has created all of these things, it can be fairly complex, especially with so many beautiful people in one room.
Okay, you look for your room and click on it. If you're not seeing it on the bottom toolbar, it's not showing up there, go to your 3 dots and you should find it there.
Perfect, thank you.
Don't think so, Maria. Something's wrong.
Yeah, I don't see mine either. Oh, let's see.
There we go. It's showing up.
Okay, yeah, thanks.
And I did see one person's on phone, so this may be a challenge.
Yep.
You can check in.
Morning. I just declined a breakout room. I'm going to go grab some breakfast and I'll be back in a few minutes. Thank you.
Okay.
Perfect, thank you.
And that's me, Julie Majors, on the phone. I'm not going to be able to get online until another hour or so.
Thank you, Julie. We appreciate you letting us know who's there.
Okay, thanks. So we're in breakout rooms.
Yeah,
and I'm just going to pause until.
Yeah, it's just
come
4
back.
minutes. Very short.
Perfect.
Great.
Sounds good.
Okay, wonderful. Thanks.
Thank you.
And Charlotte, I thought I was sharing when I wasn't, so I apologize for that.
Oh, that's totally okay. I can pop back to it. I can do it when we're done from the breakout rooms for the statement. I just didn't see in the notes where I was supposed to do it, so I kind of added it. I might have gotten a little bit frisky.
Excellent. I totally agree. Because I forgot to put it in the notes. So there.
Yeah. Do we have anyone else sitting in the room that's trying to get into your breakout rooms and you can't?
Maria, Jill and I are getting to know each other.
Yeah.
It's our first time meeting.
Yes, I saw that. And I don't know why it hopped me in here because I was trying to add someone to your group because I saw
Oh, funny.
you all know each other, but yeah, weird.
It's all
And
right.
we don't know everything. We're pulling it out, Maria.
Oh,
Like,
come on, you know it all. No.
What's a surprising thing about you, Maria, that we don't know?
Oh, geez.
or are you too busy doing 10,000 other
Oh, yeah.
I'm too busy. Let's see. I did some Greek dancing growing up. And
Greek
now I have to
dancing?
hop out. Greek dancing.
Oh,
Okay, I'll leave you with that.
okay.
Anything? I'd love to hear.
Yeah, well, my name's Bernardino. I'm at Delatone. I work for I'm the Youth Substance Use Program and Policy Coordinator for Oregon Health Authority.
Amazing. Thank you so much for your work. Anything that you want to share about maybe something that would surprise people? Like, I'm an avid Lego collector and builder, and that usually surprises people. I had to become a full-grown adult woman to be a kid.
Yeah, no, I've done a lot of things in my life. You know, I'm gonna just mostly right now. The biggest thing for me right now lately is I just been doing a lot of class and challenging online other people that from other countries and stuff. So it's been kind of interesting.
Yeah.
Mhm.
Well, I would love to hold space for you for that. It is lots of different challenges that are happening everywhere right now, and so that can be hard. And so thank you for being willing to share that.
Mhm. Thank you.
Yeah.
And I don't know if we checked in, someone from Samsung, is that a call-in?
I know Julie was calling in. Oh, go ahead. You unmuted.
Yes, Kirk Wolf, child psychiatrist.
Thank you, Dr. Wolf. And Maria, I think when we lost you, our recording stopped, so you may want to restart that.
Okay, and when I came back in, it started again, but
Okay, perfect. Perfect.
all right, should we give them a 1-minute warning and come back then now?
Yep.
Okay.
And then, Annette, do you mind going back to our vision and all that stuff? And so I'm going to do that before we do our vote, if that's okay.
Yeah, no, that makes sense. Let me, there, can you see it okay now?
Yeah, thank you.
Amber.
I accidentally left my room in the middle of my own sentence.
That's hysterical. Well, welcome. Nice to see you in your new role.
Yes, it's good to be here. Good to see you.
Same. I second that.
And I love your background, Charlotte.
I know. Isn't it amazing how these walls can just magically appear in your home?
I love it.
So I see the popcorn effect happening. That's what I call it when everyone starts re-entering our room. We're popping some popcorn today. Awesome. Okay, do we have everyone back, Maria? Perfect. Thank you. So welcome back, everyone. We're going to go ahead and keep moving forward. We have a packed agenda today, and Annette has graciously added our mission, vision, and equity statement. And in light of today's meeting, I'm really hoping if I can have a couple of volunteers to read our vision and equity statement, and we'll go ahead and start with our vision. So is someone willing to unmute and bring your beautiful voice into this space and read that for us, pretty please?
I can do that.
Thank you.
So our vision: in Oregon, all young people have hope, feel safe asking for help, can find access to the right help at the right time to prevent suicide, and live in communities that foster healing, connection, and wellness.
Thank you so much. Really appreciate that. And who would love to read our equity statement for us?
And Canada in the chat said she is going.
Yeah.
Okay, thank you, Canada.
Yeah, to achieve our vision, we acknowledge the impact of white supremacy, institutionalized racism, and all forms of oppression. The Alliance endeavors to make Oregon a place where suicide reduction and prevention is achieved for people of all ages, races, ethnicities, abilities, gender identities, sexual orientations, socioeconomic status, nationalities, and geographic locations.
Thank you so much, both of you, for being so willing and just jumping in and doing those for us. It's always a really good grounding to remind us why we're here, why we're doing this work. And it always kind of gives me goosebumps, just makes me happy to be part of this work. So moving forward with that, I'm curious if I can have a motion to approve our minutes from our last meeting.
Sorry, there.
I'll move to approve the minutes.
Thank you, Leslie. And is there a second?
I'll second that motion.
Perfect. Thank you, Canada. All right. So we've also received a nomination to appoint Angela Perry to the open lived experience position on the executive. Angela, do you mind giving us a brief introduction of yourself?
Yeah, so I am Angela Perry, she, her pronouns. I have lived experience both as a suicide loss survivor, but also someone who lives with chronic suicidal ideation. That started at a very, very young age. I am currently the chair of the Oregon chapter of American Foundation for Suicide Prevention and work as an in-home healthcare provider.
Perfect. Thank you so much, Angela. So if we can have you as we move forward with this vote, please indicate yes or no in the chat. And a voting member names is, do we have that, Annette, to put up just as a reminder of what members are able to vote, or who's able to vote, excuse me, not what members, but who's at the table?
I have a list or link I can put in if that helps.
I think Annette popped it up there for us, so thank you so much. And yes, you're more than, thank you, Marie. That might be helpful for individuals if they can't see it for some reason to just click on that. So is there a motion to approve this nomination?
I motion that we approve this nomination.
Perfect. Thank you so much. And can I have a perfect? Didn't even have to ask. And now we'll go ahead and vote in the chat. Oh, am I messing that up, Annette?
Nope, that's right. And I just will say, because not all of you were in the orientation and heard this morning, the votes are people who are appointed members. This is the list of the appointed members. Let me say that we will continue to encourage and invite in new members, voting members, but we need to be sure that we get officially appointed for just these very few moments when we get formal and do the vote process.
All right, so I see, thank you, Annette, so much. I see a million yeses in there, so welcome, Angela, to the executive, and thank you so much for volunteering to co-chair our equity advisory. Really appreciate it. All right, so moving quickly today, as I said, we have a full agenda. With that business completed, I am happy to welcome Megan Crane, Chris Savari, I hope I said that right, and Lisa Shields, who will be doing a presentation with us today.
Good morning, everybody. And I'm the lucky person who will be doing the slide presentation today, but I work very closely with Megan and Chris and Catherine. It's nice to see you here today. So thank you for inviting us to talk about shared risk and protective factors. We have a whole team of people working on this initiative particularly in the overdose and substance use space. And just to introduce myself, I'm Lisa Shields. I work in the Public Health Division at Oregon Health Authority in the Injury and Violence Prevention Program. And I mainly manage overdose prevention projects, and so that's why we'll be talking about the overlap between suicide and overdose prevention, but this applies to many other outcomes beyond suicide and overdose. And I also like to share lived experience. I have lost family members to suicide, and personally, I am a person who lives with chronic pain, and there's a lot of substance use disorder in my family. So I feel like I'm with my people, and thank you for inviting us to talk. And what else did I want to share? Oh, I know. I like to acknowledge that all of us work in a really sometimes challenging space, and it can be really discouraging when at least I sometimes feel like, am I really making a difference when I look at, for example, astronomical increases in overdoses, and it can be really discouraging. And I'm hoping that by stepping back and talking about shared risk and protective factors, that we can see that as an encouragement to keep going forward, because I find it to be an exciting collaboration idea given our many limited resources. So I'm hoping we can there together. And Chris and Megan, did you have anything to say before I launch the slides?
No, I think you covered it. Thank you, Lisa.
Yeah, Lisa, I'll just add, this is Megan, that, I think this is a start of a conversation. We wanted to come here and talk about some of the work that OHA is doing, recognizing that there's already a lot of this work going on, but starting this discussion and, ways OHA is starting to think about this work. And then, as you're listening to Lisa's presentation, think about what you're already doing or opportunities you see, so we can start this discussion and understand, what this is looking like at the local level as well, and how we can work together on this framework and moving this idea forward. Thanks, Lisa.
Thank you, Megan. That's such a good point. I acknowledge that I have a feeling some of you in this room are much more expert at this topic than I am. We started doing this work in the Injury and Violence Prevention Program literally because we had a little bit of funding to spend, and we were starting to realize that in the overdose prevention world, it doesn't live in a vacuum. It's connected to so many other risk and protective factors and outcomes. And the dollars to fund prevention for for substance use disorder and overdose prevention are so few. Sometimes it feels like a drop in the bucket. And so we realized we really urgently needed to collaborate across programs to see how we could impact overdose prevention and suicide prevention together. So I'll start sharing my screen. Oh, before I go, in your calendar invite, Annette attached a one-pager. It's really a two-pager. We call it a one-pager that gives you a project overview. And then Annette also has the slides that I'm presenting today that she can share with all of you. And then there's also a draft document attached to the meeting that was created by a contractor. They're called Health Management Associates. And we really wanted some visual aids to show us how our work overlaps across programs. They're quite drafty and not self-explanatory, but we'll just be looking at those. And I do invite you over the next week or two to really look at those and provide feedback to either me or Megan or Chris about how we can make these better and more useful, because we're still working on that. So with that, I will pause before I launch my slides. Does anybody have any questions or comments?
Just to note that those links that Lisa was referring to are in the meeting, the Word document in the meeting agenda, the links to them that Annette had sent out.
Thank you, Megan. Okay, I'll share my screen. This is always the scary part for me. I'm like, is this working? Okay, so, Does that look okay?
Yes,
okay.
great.
Okay, sweet. I don't know why I'm still so scared of technology so many years into this, but okay, here we are. So I'll be talking about our Shared Risk and Protective Factor Initiative. And I also would like to acknowledge that we're not married to this branding. I think lots of us have been working on upstream ideas and protective factors under different frameworks and different names, and that's totally okay. For example, the state of Colorado changed the name of their initiative to Breaking Down Silos, and I love that as a name for this work. So it can be called all kinds of things. So what I'll be talking about today is the background and definition of what the shared risk and protective factor approach looks like. I'll talk about the rationale for this approach, and then some examples of shared risk and protective factors for substance use disorder and suicide. Again, we could choose all kinds of things beyond these outcomes, but those are the two I picked today. I'll tell you a little bit about what OHA is doing around this. And then I'll provide some concrete examples of projects that fit the definition of a shared risk and protective factor project. I have a feeling many of you are already working in this area, whether or not you're calling it that. And then we'll kind of go through that one of those graphics I mentioned. I'm sorry, I'm laughing. I'm laughing because Megan and Chris and I are struggling with those graphics about how to use them, and so it's a work in progress, and I welcome your feedback. So All right, so forgive me, this is probably really basic for most of you, but I just wanted to talk about the context of social determinants of health. So if we look at this graphic, I pulled this from Safe States Alliance Connections Lab. There's a link, and that is really all about shared risk and protective factors, particularly related to injury and violence outcomes. But the circle in the middle represents a population, and then the other circles show all of the things that can affect quality of life in a population, or some of the things, not all of the things. So such as physical and mental health, living wage, stable homes and neighborhoods, educational achievement, access to high quality goods and services. And when we say goods and services, that includes healthcare, treatment. It's not just things that you, tangible goods that you purchase. And then this really important factor, which is connectedness, engagement, and participation. So all of these factors that influence the circles are known as the social determinants of health. I don't mean to be talking down to anybody. I'm just putting it out there that this is how this is connected. So when we look at what we call social determinants of health, that includes these factors such as economic stability, what kind of neighborhood you live in, what is your zip code, the built environment, how easy is it in your neighborhood to feel safe while taking a nice healthy walk, education, social and community context, resources, etc. So that just puts it in the context of social determinants of health. And I'm trying to advance my slides and it's not working. Hold on. Okay, sweet. So when we all, I'm sure, are very familiar that populations do not have equitable access to the social determinants of health, and that can go as small as within a single neighborhood. It can go within a city, within the state, within the country, across other countries. And I really like this definition of risk factors and protective factors. Again, I grabbed this from the Safe States Alliance Connections Lab, but when populations lack this access to these social determinants like healthcare or economic stability, it makes a population less likely to attain the best possible health and quality of life outcomes. So when I say risk factors, that's what that's all about. And when I say protective factors, that's about when populations can obtain the skills and supports necessary to avoid risks or promote resilience in the face of risks. So you're more likely to have an optimal outcome when these systems are in place. And the reason I really like this definition of risk and protective factors is that it removes the responsibility from the individual and puts it in the context of systems. So feel free to use these slides or grab this language if you ever end up wanting to present on this. So in the injury and violence prevention world, CDC put together a shared risk and protective factor guide called Connecting the Dots. This was put together in 2014. It's had some minor updates since then, but to be honest, it's pretty out of date, but it still provides a solid framework for showing the evidence for this vision. So it shows the connections between different forms of violence, how these connections affect communities, and it recommends that we really need to start prevention efforts early and keep it going across the lifespan. And one of the limits of this document is that it's about violence. It doesn't include injuries such as overdose or substance use disorder. And so it's missing some stuff, but it's still a strong framework. And as a matter of fact, we, Health Management Associates, that contractor that I mentioned, conducted a literature search for us to update evidence base and to include other outcomes beyond violence. And so that will be a public document. We're putting together a web page with resources for you. So that is coming soon. So this is just okay, it's a little blurry. It's a screenshot of the CDC Connecting the Dots. I just wanted to show you what this looks like. So on the left, we see the level. So this screenshot shows societal and community. The Connecting the Dots document also includes individual and family levels. And there's a list of risk factors on the left. And then we see types of violence at the top in purple. In this screenshot, we can see child maltreatment, teen dating violence, intimate partner violence, sexual violence, youth violence, bullying, and suicide. And actually this table continues. I think it includes older adult falls. No, it includes something around older adults. Anyway, so I invite you to look at the Connecting the Dots document. It's available online. We can also attach it if you want to check it out. The X's in the table represent where there is an evidence base. So, and the little numbers in superscript are the links to the references in the document. So, for example, if we go all the way over to the right and look at suicide, you'll see that there is strong evidence to show that, for example, media violence is a factor in suicide, and it also is a factor for sexual violence and youth violence and bullying. So that's where you see an overlap. For example, societal income inequality, you can see is a factor in child maltreatment, intimate partner violence, youth violence, and bullying. And then I'd also like to share that just because there's not an X in the box doesn't mean it doesn't exist. It's based on what kind of research has been done. So I think, you know, we can agree that, for example, community violence, yes, suicide is missing an X in the box, but I'm sure we can probably guess that is an important factor in suicide prevention. It's just that the literature isn't there yet. So then when we look at this other table in Connecting the Dots, it shows the protective factors. And there is a lot less research on protective factors than risk factors. And so, you know, it's still emerging all the time. And at least at the OHA public health level, so much of our work has really been organized around risk factors. It's about how we display our data, how we tell a story of a community, how we fund communities to prevent outcomes. It's really organized around risk factors, much less around protective factors. And so really that's where we're focusing a lot of our efforts now. How can we expand our efforts both to tell a story of a community about what is going well, what are the protective factors that we see, and also how we organize funding. So here's just a little screenshot again showing protective factors at the individual, relationship, and community level. So that's listed on the left in blue. And again, we have those same outcomes up above on the x-axis in purple. Then you can see the overlap of shared protective factors. So if we look at, for example, family support and connectedness, wow, that affects, you know, all of these outcomes across the board. Okay, it doesn't reflect intimate partner violence prevention or sexual violence prevention. But that's, again, it's a limitation of the research. It doesn't mean that that's not important. So again, connection to a caring adult, I'm sure that that is an important factor in suicide. It's just that it hasn't been researched as of the year 2014 in this document. It's still, you know, an useful visual tool just to see where the overlap is across these violence prevention programs. So I really like this definition of what is a shared risk and protective factor approach. This came again, you know, I guess I just stole everything from Safe States Connections Lab. But this came from there as well through Safe States Alliance and Health Management Associates. But really, it's about aligning efforts to improve outcomes, multiple outcomes. Okay, so if you look at the first factor, and a shared risk and protective factor approach improves multiple population level outcomes. It impacts the social determinants of health in ways that are positive and equitable. It connects issue-specific silos and engages partners across multiple disciplines and sectors. And really, in a nutshell, if you get people representing different programs, such as substance use and overdose and suicide, in a virtual or in-person room together, just talking about how we can collaborate, that is a shared risk and protective factor approach. It's really when you're, again, breaking down these silos and trying to work together to improve multiple outcomes. And really, this is about collective action and maximizing limited resources. So how can we influence more than outcome at once, given our very limited dollars? So I'll move forward and just talk about substance use. So the reason I listed substance use first here, showing you what some of the risk factors are and some of the protective factors are, is because I'm sure you will recognize many or all of these risk factors and protective factors as being also risk and protective factors for suicide. So when we look at adverse childhood experiences or racism or lack of opportunity, I think these are risk factors for multiple health outcomes, and some of the literature definitely supports that. Having few friends or few healthy relationships. Then we look at these protective factors. These are protective factors that influence all of us, right? Secure attachment, supportive families, positive peers, availability of resources, academic success. High school graduation is a huge factor. Hate crime laws, alcohol policies, etc. So this is, obviously not a comprehensive list, but it just shows you some of the known risk and protective factors. And then when we compare some of these risk factors and protective factors to substance use and suicide, these are some of the overlapping risk factors and protective factors according to the literature. So again, ACEs, low academic achievement, such as not graduating from high school, limited social coping skills, lack of a social support network, lack of access to behavioral health. And then these shared protective factors are resiliency, connectedness, positive norms, economic stability, freedom from discrimination or bias, access to education and healthcare. These are a huge overlap across these outcomes, and also for several other outcomes that we won't go into today. So when we launched this shared risk and protective factor initiative in Oregon 2 years ago, we brought together a team of people that still continues to meet weekly. We have representatives across, I think all, if not most, if not all of the public health division programs. And we came up with a set of principles that are in alignment with Oregon's state health improvement plan, Healthier Together Oregon. And given that we already talked about what the definition of a shared risk and protective factor approach is, we really wanted to build on that and define some of the project principles that are important as we really change how we do business. We have a history of working in a very siloed way. A lot of that is due to how our funding comes through for very issue-specific topics. It's about de-siloing our efforts, but it's also about less top-down and more authentic community engagement. What does a strong bi-directional relationship look like? How can community be involved at all phases of a project and involved as decision makers in this relationship? How can we center health equity? We originally had put our first principle as centered in health equity. And we got called out on that by a few partners saying, well, are you centered in health equity or are you working on it? And we had to acknowledge that, this is front and center a priority and we're still working on it. And so it's a constant learning process and a constant change process. And then if we look at that fourth principle, strength-based community data collection and reporting. So this is when I was talking about, so much of our data collection is around risk factors, but how well do we really tell a story of a community in terms of what's going well? What are the protective factors that exist in a community? And so that is another priority with how we tell stories with data. And then upstream prevention strategies. So as we saw with social determinants of health, those are considered upstream factors. How can we really work on improving these upstream strategies so that we're influencing not just one program, but multiple outcomes and improving health in general? And then we also wanted to acknowledge that evidence-based strategies are not historically tested with culturally diverse populations. And so this is about honoring promising practices, community wisdom, and culturally appropriate interventions. So let's not be so tied to what the dominant culture literature is showing us at this point. Let's really look at what communities can tell us and show us. So I'm going to talk about 4 concrete examples of what a shared risk and protective factor project can look like. I pulled some examples of some small projects and large projects. And so first one we're going to talk about, I'm sure many of you are familiar with and probably worked with directly. So that's the LGBTQ plus mini grants that was supporting community protective factors during COVID. So I'll go into detail about that in a moment, but that was an opportunity in collaboration with OHA, you guys, and then there's a healthcare quality improvement project that Megan and I have worked on called Pinpoint Antecedent. We'll talk about that. That's with Oregon Rural Practice-Based Research Network. I wanted to show you just how this applies to policy change with House Bill 4045. And then I wanted to show you just a very simple shared risk and protective factor project that Kansas did that is very replicable. So, okay. So let's go back in time during an extreme time of community stress during COVID-19. I don't know about you guys, I'm still pretty stressed out about COVID, but it was really scary for quite a while. And during that time, we were able to take some of these COVID dollars and work with the Alliance and several of you to fund community-based organizations for upstream suicide prevention. And what was so groundbreaking about this project was the project was framed around protective factors. So community resilience, social cohesion, and visibility. This project prioritized awards to groups led by and are serving communities of color, rural, frontier, and our disabled folks. The application process was very low barrier. The reporting was very low barrier. It was a very simple application and reporting structure. The funding announcement specifically said, hey, no idea is too big or too small. Let us know what you need. Anybody could apply for it. You didn't have to have any specific suicide prevention knowledge, expertise, or explicit involvement, because the idea is that by funding these grants to improve these protective factors, down the road, it certainly affects suicide prevention as well as other outcomes. So these are some examples of the LGBTQ mini grant projects. They were absolutely amazing and really helped us at OHA see that communities have way better ideas than we do. We wouldn't have thought of any of these. And so it really opened the door to a lot more creativity. And we actually have a current braided funding opportunity for community-based organizations across programs that we modeled on this. So there are tons of really cool projects coming out of that too. So these examples are Klamath County had a Pride Circle, Multnomah County had a podcast called All in My Head that was very well received, won some awards. I'm sure some of you are involved in that. An Indigenous LGBTQ plus film festival. Malheur County was able to build capacity around Project Dove. And then Friends of the Children in Portland and Multnomah County used their mini grant to re-engage alumni and build capacity to then receive more funding from the Upswing Fund. So also these groups formed huge partnerships with each other and across and beyond the cohort, lots of local and national attention. And these grants by typical public health funding standards were really mini grants. It was a lot of project for not a lot of dollars. So we found that so encouraging and exciting. Okay, so the Pinpoint project is through the Oregon Rural Practice-Based Research Network. This is winding down this year. This was funded by a CDC grant, but this was really a project about improving pain and opioid prescribing in primary care. It's a QI project, helping clinics and clinic teams better manage these issues. And ORPRN decided to combine it with an unhealthy alcohol use expert project. And then Megan was able to supplement this project with some of her suicide prevention funding to really talk to primary care providers about suicide prevention and find out what is needed in primary care to better address suicide, both pre and post care. And the Pinpoint Project connects clinics to regional and state overdose prevention initiatives, and also now suicide prevention initiatives. So this was an example of actually a kind of a simple shared risk and protective factor project. We had an ongoing project addressing pain and opioid prescribing, and then by just having people talking about their programs, we were able to dig up some funding from another program and add another outcome. So, you know, it can be as simple as that. It's about collaboration. And then this is our really exciting policy win, House Bill 4045, which is a bill from this year that is to prevent community violence. And the way this all came about was OHA was invited to participate in a work group to plan legislation on community violence. So, you know, we're not always at the table when these bills are being planned. So it was a really exciting opportunity. And that included our injury and violence prevention manager, Laura Chisholm, in this work group. And the project team developed a report called A Public Health Approach to Reduce Community Firearm Violence. And so in that report, the goal was to increase knowledge and awareness of upstream risk and protective factors. And then it really highlighted the importance of addressing risk factors such as exposure to community violence, lack of social cohesion, and then the importance of supporting protective factors such as connecting youth to caring adults and positive activities. So the result was a $5 million allocation from this House bill to reduce community violence and expand hospital-based violence intervention programs. And what's exciting here in the bullet points was half of that funding, or $2.5 million, is for community grants to address risk and protective factors to decrease social pressure to engage in community violence. And that money, Laura was updating me, this is underway. The funding is getting out the door. The projects are underway. So I'm sure you'll receive an update about that at a future meeting. And then, oh, and I also wanted to share, you know, this whole policy thing, it just came about from having a person in the room who recommended talking about this and putting it in the report. And that's how policy happens. You know, it's just about, it starts with a conversation. So I find that to be very exciting. And okay, then I had this little project just to show you what happened in Kansas. This is an example in Connecting the Dots from 2014, that CDC document we looked at. So the Rape Prevention and Education Program looked at high school student survey data to really look at the associations and shared risk and protective factors between forced sex and suicide attempts. So that right there is a shared risk and protective factor project. And then they took that data and shared it with stakeholders to educate folks on how these forms of violence are interconnected. So, you know, it can be as simple as that. Look at your data, look at the connection between two outcomes and share it with your partners. That's a shared risk and protective factor project. Okay, I'm going to pull out so I can see you guys. This is just a screenshot of the one pager. I'll pull up the real one pager in a minute, but I just wanted to stop here so we can have a discussion, because I would love to hear from you. Do you see any opportunities for applying this approach in your work? Is this work already underway in your role? Is there anything you'd like to share? Criticism, complaints, comments? I'm here for all of it. So I'll just open that up now.
As people are thinking, I'll just throw out some other ideas, you know, or some other projects kind of specific. I was thinking about OHA received some SAMHSA funding to do some work around intimate partner violence and suicide risk with Portland State University, and there were some tools developed, so I'll put the link in there if you aren't aware of that. The OHA suicide prevention team is currently working with OHA problem gambling program to put together a training kind of really showing the link that we know exists between problem gambling and suicide for direct service providers. So I'll stop there because I want to hear other voices, but just trying to get it started.
And I just want to, while people are giving a moment of thought here too, say we just have probably about 2 more minutes to ask questions, just to be respectful of time and other presentations as well. So I'm going to be quiet so you can have those 2 minutes. And then if you have continuing questions that come up, please feel free to put them in chat, so that our great presenters can try to answer those for you in there.
I'd like to acknowledge that some of this conversation actually started when Gally and Clackamas County reached out to Megan to find out how they could better connect their work across substance use and suicide. And it really started with just a bunch of people in a room sharing what we're doing and looking for opportunities to connect. And so this presentation today was a result of that initial conversation.
And being respectful of time, again, this is the start of a conversation. So I am hoping that this will continue, that we can find more ways to engage the Alliance. Because again, we know that you all are doing this work on the local level in your communities. And so again, want to learn from you as we're figuring out this work, as much as trying to share examples we've either seen within OHA or learned from others.
Well, thank you, Chris and Megan and Lisa, who's the one who spoke today. For those of you I haven't met, I'm Annette Marcus. I use she and her pronouns. I'm the policy manager with the Oregon Alliance to Prevent Suicide. And our next presentation we're going to be hearing actually is very connected to what we just heard, which is, or the reason I've invited them to speak here is because of my belief that there are shared risk and protective factors for suicide and for child abuse, and especially as we look at youth suicide. And I am aware that Jeff Todal, who's going to be presenting for us, has been very involved with an initiative in Lane County that is looking to really reduce child abuse significantly, and is part of a coalition that's working to really do an integrated approach to violence prevention, very similar to the kind of integrated approach that Lisa was speaking with us on. And what I've asked Jeff, who is both a colleague and a friend for me, is to talk to us about this new study that's going to be happening in schools, and not just tell us a little bit about the study itself, but also tell us a little bit about the process that his organization, our organization, I should say, it's in Lane County, has advocated for and had passed in the last legislative session. So this survey will be occurring in targeted schools across the state. So with that, let me introduce Dr. Jeff Todal from the Center for the Prevention of Abuse and Neglect at the University of Oregon. Welcome, Jeff.
Hey, thanks, Annette. Hey, everyone. And will I be able to share screen here in just a moment too, huh? But let me just make a couple comments. So I was listening in on parts of the conversation, and Lisa, what you just presented, there a lot of that I didn't even know. It's like, oh my gosh, there's incredible things happening. So I appreciate just being involved in this conversation and really agreeing with Annette around the interconnectivity of the risk and protective factors and really the connection around the solutions. And I glanced at the Oregon Alliance to Prevent Suicide's mission, vision, and equity statements, which are incredible. And it just really resonated for me. And looking at the vision, in Oregon, all young people have hope, feel safe asking for help, can find access to the right help at the right time to prevent suicide, and live in communities that foster healing, connection, and wellness, and which is attainable and an incredible vision. And as we think about the work that we've been doing in Lane County and throughout Oregon around the prevention of child abuse and neglect, those are the same kinds of solutions. That context, that environment, the trauma for kids happens much less often, obviously, in the same way that suicide would happen much less often. So I just feel like I'm among kindred spirits. So, all right, Annette, so do you mind giving me the ability to share? Maybe I have that now. And what I'd like to do is just introduce very briefly, I know we're tight on time, is to introduce what we've been calling the Oregon Child Abuse Prevalence Study, its intent, and then especially want to really highlight the youth voice piece of this effort. And then we'll say a bit about some of the legislative efforts that sort of how we got to this point. So as Annette had requested. So that sound okay? All right. Okay. You see that okay?
Looks great. Thank you.
Thanks so much. So just take a look at those questions if you would. And this is sort of leaning into prevalence and what do we know about this? So how many Oregon kids experienced child maltreatment, including physical and sexual violence, neglect, exposure to intimate partner violence or domestic violence? And then we're including in our definition of childhood trauma, identity-based violence. So the kinds of violence that happens as a result of my identity, gender expression, sexual orientation, race. And we have a few other the protected classes included in that work. And we also have that reflected in the way that we're asking these questions. And we don't know in Oregon, and this is largely true in my view throughout the United States. We don't really know, based on the ways in which we've been asking these questions, whether the rates of this kind of trauma for our kids are higher or lower now than they were 20 years ago. And it's not clear where we are in terms of our trajectory. And so one piece of the purpose of this work is to get a better sense of prevalence, to track it across time, and to hold ourselves accountable to more accurate information about this. And the pilot really leans into youth perspective on this. So we did this work in Lane County. We now have funding support, which I'll tell you about in a moment, to do this work across the state of Oregon. It'll be the first time that's happened in the US in this way. And we're leaning into high school juniors and seniors around their perspective on the trauma that they may have experienced. And in particular, we're also asking about youth recommendations for prevention and change. So that's another piece of that that I'll mention in just a minute. I wanted to just give you a sense of this. These are Lane County youth as a part of the pilot. This probably won't surprise all of you. This represents a lot of kids. And if we had more time, I'd tell you more about how we're doing this in a way that's trauma informed, how youth experience this process. Our team goes into the classroom. And if you have questions about that, I'd be very happy to talk to you about that later. We think that there's a way to do this, and that is trauma informed, that inspires youth and is validating to their experiences. So 29% can see some of the questions we asked around sexual violence. We ask about 17 questions specifically about sexual violence. And 29% of kids in the Lane County pilot said that they had a sexual violence experience. A bit here about physical abuse. These are sensitive, hard questions. You can see the ACE study there. I'm assuming many know about the Adverse Childhood Experiences study. We found that with at least in the pilot, that the rates of trauma that were being reported far exceeded what has been done with the ACE study and in something called the NAT-SEV. And you can see some of the questions are being asked there. Has anyone ever hit you over and over again with an object or fist? I'm not going to dwell on these percentages too much. Let me just show one more slide. And then these are more kids seeing or hearing intimate partner violence or domestic violence. And again, a couple of examples of some of the questions that we've been asking. And then the relative comparison to the ACE study. And I'll get this to you, Annette. These slides for those who want to take more time with this, and I know we're flying, but I'll get that to Annette today so you'll have access to it if that's useful for you. And then a bit now into some other dimensions of this. We asked, just based on this one question, as a part of the prevalence study, we're asking about health and well-being, grades, and we're asking about social connection and social capital. So there's a lot we can do. It's more than actually much more than prevalence. But to this one question, at any time in your life, did any of your parents or another adult in your home, because of an argument, break or ruin anything in the house or punch the wall or throw something? So based on that one question, we just looked at grades. So a yes response by grades. So youth in the pilot, we'll see what happens as we do this statewide. Youth who said they had had mostly A's and B's, 47% said yes to this one question. So just notice. And then when we asked about, and then these are youth telling us what was true for them in terms of their grades. So this is self-report, mostly C's, 53%. And then when we asked about grades, D's and F's, so 82% of youth in the pilot who were receiving D's and F's on average said yes to this one question. So the relationship between trauma and school performance, health and well-being, we know a lot about that. This is what Oregon youth are telling us. And then I want to just highlight this too. You know, is a culture of silence, denial, minimization, shame, a significant risk factor for suicide. At least to my understanding, it is, perpetuates that problem. Also true with a childhood trauma. And so among the pilot folks, you know, we asked, have you shared this with anyone at any time? So these were our youth who had a trauma history. They're now 16, 17, 18, or 19. Have you shared this with anyone at any time? And nearly 50% had said they'd never shared with anyone at any time. And of course, that's not an accident. It speaks to the norms that perpetuate this issue. I think about the intersectionality between this norm and suicide risk. So we're doing a lot of the same work, I think. We'll see what happens with this percentage when we do the statewide. I think it'll probably likely still be about right here. And maybe higher for some of our youth. And then now what I want to just sort of move to a bit here briefly, and this is the part of this work that I wouldn't be doing this for me if we weren't also doing this. So this is the portion where we're also asking youth about their recommendations for change. And so the youth, as we do this statewide, and we piloted this, we met, one example, we met with the youth of 15th Night in Lane County on Monday and asked them these questions and sought their feedback. But we're asking youth their recommendations for change. And here's some examples of this. So youth participate in the questionnaire. We move into their classrooms. They complete it on an iPad. We're inviting them to do focus group conversations with us at a later date. Here are some of the questions we're asking. And the idea here, again, and I'm going to highlight this, is that as we raise awareness throughout Oregon about the prevalence of childhood abuse and neglect and other forms of identity-based violence, we want to pair that with youth-inspired, very specific recommendations for change. And we think moving those together, we're asking youth also about their recommendations for how we get this information out and by what mechanisms. And they're pretty genius. The conversation I was in on Monday, the ideas that they had about how we move this into community was, if we do 20% of what they recommended, we'll be far ahead of where we are now. And then here's one quote that has sort of driven this work. When we went in and asked youth about this, essentially they said, you know, if you're asking us these questions, you better do something about it. And so really a call to action from our youth. And we're committed and looking for more and more partnerships to make sure that we do the best job we can to move this information into Oregon communities with specific kinds of actions that youth are recommending, so that this moves from awareness of prevalence to very specific and concrete action taking throughout Oregon communities. And then my final comments here around prevention. You may know about some of these things. I could send these to Annette too as an attachment. So there's, and again, looking at the intersection between all of the work around suicide prevention and then the prevention around violence. There was a report issued just a bit ago, about a year ago, that looked at the 20-year impact of the Oregon Attorney General's Sexual Assault Task Force. So they've been working at that for 20 years. And what difference has it made? And so the Transforming Space and Place report is a 20-year snapshot on the impact of that work. So if you have an interest in that, that's a concerted effort for 20 years. It really is a win for prevention. You'll see what I mean as you read that. And then also the Protect Our Children report just recently issued. It's a partnership between the center that I direct and the Ford Family Foundation, looking at 7 years of sexual violence prevention, 40,000 Oregonians trained, mostly rural Oregonians, in a curriculum to prevent child sexual abuse. That's a report that shows what do we know about the impact of that work. So, and then the last thing I want to just say a bit about is the funding to do this work statewide. It took us 4 sessions. We worked closely initially with Representative Alyssa Kenney-Geyer. You might know and remember Alyssa Kenney-Geyer. And then with the incredible Representative Anna Williams, who, if I understand correctly, is now with the Oregon Health Authority, which is fantastic for Oregon, was instrumental in making this happen. And then Our Children Oregon were incredible partners. The way in which they work with us and our team to have success around the legislative support of this was one super rewarding, and a lot of skill in the work we did with Our Children Oregon. So that led to $700,000 to do this particular work statewide. So I will stop there. Does that sound okay, Annette?
Yeah, I think that's great. Jeff, just a couple of questions. One,
Yeah.
Can you talk about how this will be happening statewide? Like, is every school going to have this? We know that the Healthy Teen Survey has been a real struggle to get schools to do. So how's this going to actually?
Mm-hmm. Yeah, and we're hopeful that this complements the Healthy Teen Survey, and I really think it does and can. So a key difference is with this particular work is we're doing a stratified random sample. So we're trying to represent the entire state of Oregon, and this is about 2,200 youth in what would be probably about 65 or 70 public schools. And then we also have some additional support from the Ford Family Foundation to go into spaces where youth are not in public schools for all the reasons they might not be, so that we can be more and more inclusive in who is in this work. And so I don't know if that gets at your question, Annette, but yeah.
Well, the reason I ask is that we've been, obviously, like I think everybody does, really struggling with how do we really, really understand the story of what's happening with youth and young people in the state, and how does that connect to suicide rates and suicide attempts. And so it's interesting to hear about using that kind of statistical sampling, because
yeah, we think we can get to pretty good representation. And then we're going to oversample. I'll tell you too, if there was one question y'all would want us to be asking youth, we do have some questions in the survey itself. Some are borrowed from the Student Health Survey, but if there's one open-ended question y'all would want us to ask, it's a pretty unique opportunity. We're going to talk to a lot of Oregon youth. If there's something you would want us to ask, we would definitely want to consider that.
Jeff, we have a comment in the chat asking if you're capturing any protective factors in this work, and such as what helps you.
Yeah, thank you so much. Yeah, we quite a few. We're asking a lot of questions around, what we think about as protective factors, questions around connection. And do you feel like you have someone you can talk to about anything? Do you feel connected in your neighborhood? There's some of those kind of classic questions around social connection. One of our, for the 90 by 30 initiative, which is an effort in Lane County to reduce child abuse by 90% in one US county. Our tag is a connected child is a protected child. And so we ask a lot of questions around connection, kind of based on that assumption. Yeah.
I think that that whole area of connection and positive social supports is one of the areas where we really, these two fields just completely mesh with each other. I'm curious about, before you came, Jeff, we were hearing a presentation about the intersection of suicide prevention, risk and protective factors, and SUD. And I'm curious about how within the child abuse prevalence study, substance shows up as well. And is there any specific question related to mental health, suicidality?
Yeah. Yeah, we have several questions that do that. Yeah. Mm-hmm.
I don't know if Alyssa is here today, who chairs our evaluation committee, but I'm quite sure our evaluation committee would be very interested in the opportunity to think through what might be a very helpful question to have as part of that. And I think would need to look through and review the questions that are currently part of it to see. But it just seems like a really amazing opportunity.
Our timeline to begin this is about February. And so I'd be happy if that's useful in that to connect with Alyssa, if you don't mind sharing, if it's okay, Alyssa's contact information. Yeah, it's a unique opportunity. We want to partner in all ways we can.
And Jeff, you have done an amazing job catching us up. So I'm just curious if anyone in the room has additional questions. I've seen a couple come through the chat and we've talked about those, but really want to make sure that we utilize this time to ask those questions and perhaps give Jeff some of the suggestions he's saying he's open to. Another question in the chat is, how much does this cost?
Mm-hmm.
Those are the big questions, huh?
Yeah, no, that's all. Yeah, gosh. Well, we were funded initially by the Ford Family Foundation and Meyer Memorial Trust to do the pilot. And that was about $175,000. We're able to do this statewide for $700,000. And it's mostly that's time, personnel time. And then we're traveling, we're going to the schools and really trying to be trauma informed. We bring 3 staff to every school we go to. And so we're doing it for about $700,000. And we had an additional $180,000 from the Ford Family Foundation so that we can oversample some parts of the state to make sure that we're representative. Yeah. The other thing I'll say quickly is we reduced what is often a very high indirect rate that goes to universities down to 5% for this. Yeah.
Jeff, this is Leslie from Lines for Life. I have put Alyssa's email address for you in the chat.
Nice. Thank you. Okay.
Yeah, it's
awesome.
my pleasure.
Thank you.
Your work's
Yeah.
incredible. Thank you so much.
Well, thank you. Yeah.
Yeah, lots of echoing about that. Some additional comments in the chat saying, amazing work. Thank you for sharing.
One more, just because I know this work a little bit, Jeff, I think another area that we have in common with child abuse and suicide prevention is care that needs to be taken in messaging. Yeah. And I know you were moving us through it quickly, but I think if you could say a little bit about how you're going to try and be trauma informed and asking these questions for youth and young people in classrooms.
Mm-hmm. Do you mean in the classroom itself, Annette, or the data, sharing out the data?
No, I mean in the classroom itself. Like how do we ensure that the process of asking the questions is not causing harm, but is providing an opportunity to get the right help at the right time?
Yeah, thank you. That really became for us the most important question, to do this in a way that doesn't cause harm. And so we feel confident about this because we spent a lot of time asking youth and getting their direct feedback. We spent a lot of time a couple of years ago. We also asked in the pilot, so let me just say this quick. We also asked in the pilot how it felt to participate. And let me just read this to you real quick. 15% of youth felt upset or sad. These are because we're asking really hard questions. 43% felt neutral. 15% felt inspired. 26% felt hopeful. and 39% felt, quote, supported or validated because people are learning about child abuse. So we mostly heard from youth that they appreciated that this was being asked, that people were turning toward the issue. And then it's anonymous, voluntary. Youth are informed that we're coming several weeks before we're there. So we put a lot of energy into consent, choice. Our team talks it and tries to validate and normalize harm, and quite a bit more. So parents' assent or consent. So we have on our website some frequently asked questions that go more into those details. Yeah, just knowing we're tight on time.
That's great. Thank you. Any other questions or comments? If not, we will move on.
There was a question in the chat from Jonathan.
Jonathan?
Yeah, is that around sampling, Jonathan? Which schools? I thought I saw. Yeah. Well, yeah. When we were building this out and sort of putting it together, we worked with Clyde Dent. I don't know if Clyde's with the Oregon Health Authority any longer. Clyde helped us with the sampling. So it is, the state divided by strata. So making sure that all parts of the state are represented, all income groups, different demographic categories. So it's really random selection. And we're just now in the process of reaching out to the schools. And we have ODE support with this. And so it's that was the process, basically.
I just wanted to comment and said I put this in the chat a little bit, but I loved hearing the feedback from the youth. It reminds me of the importance of normalizing. So similar to the same work we are doing around suicide and the intersections of these topics and how powerful it is when we ask someone directly if they're thinking of suicide, because it allows them to be heard and to have that opportunity. So I just really appreciated that part of the sharing as well, like hearing how those students felt, knowing that they felt empowered and that they had a voice and that it was being brought to light. So I thought that was really great.
Oh, good. Yeah, thank you.
Well, Jeff, thank you so much for the presentation, and I hope this is the beginning of a lot of work that we will be doing collaboratively, because really the scope of what you're doing, while the focus has been Lane County, it really has implications for statewide work. And I also know that this group, the center, has been working with actually the University of Oregon Suicide Prevention Lab and collaborating to do work in this through the South Coast Education Service District down, I believe, in like Coos, Curry, Douglas County, to really integrate trauma-informed work. And I know because John's part of that picture, that thinking about Addie's Act and the way we're implementing suicide prevention will be woven through there. And so there's many interconnections between kind of our statewide collaborative and alliance that brings people together and the work that Jeff and all the folks at CPAN and 90 by 30 are doing to bring communities together to prevent child abuse.
Thank you so much for both of those presentations. They were amazing. Thank you everyone for being willing to sit and participate in some really hard topics. And just remembering to provide self-care for yourself during this. If that means you need to get up, step away, whatever that looks like. And again, as Annette said in the chat, be sure to reach out if you need some additional support. These topics are important and valuable, so we can move this work forward, and can also feel a little bit hard sometimes. So with that all being said, I'm going to go ahead and pass off to Annette to look at some updates and presentation discussion, on policy and mini grant update.
All right. I'm very excited. And the reason I'm very excited is that, as you may remember, we had, as an alliance, we put out a request as one of our priorities is to really ask the state to begin to push funds out more to local regional coalitions. And we put in a proposal asking to replicate a process somewhat like the LGBTQ mini grant that was talked about earlier. That would be a process for mini grants to go out to local suicide coalitions. We had a firm yes on it in the spring, and due to no intention on anyone's part at OHA, there was incredibly complex budgetary, I don't know what to call it, but just barriers to moving this through. And we learned this summer that it wasn't going to happen. And this is the power and impact of the Alliance together. The executive committee made a decision to really challenge that and say, how can you be centering equity and let an institutional barrier like that get in the way of getting funds to people, you know, on the ground in their communities to do suicide prevention work? And I guess I always like to make this distinction between the institutions and the people that are in them, because the SPIP team, the suicide prevention team, and I know Megan put a lot of work into this, and Jill did, to really kind of went to bat within their bureaucracy once they received this letter from the Alliance pushing back on that decision. And that letter was actually directed to the director of OHA, and we immediately heard from the director of Children's Behavioral Health after that letter went out. And the good news is that we received the news just last week that they have figured out all the various bureaucratic complexities, and there is going to be $417,000, 338 available to go out to coalitions across the state. The funds, the grants will be maximum $20,000. Will be administered through the Association of Oregon Community Mental Health Programs and the Oregon Alliance, working closely with OHA. And we really want to, like we did with the LGBTQ grant, where that mini grant process was, the application process was designed by a group of LGBTQ community members who are in our advisory group. We really want to engage those of you who are working in local coalitions in creating a fairly simple, low barrier, although also effective process for people to apply for these mini grants. And we have a meeting of network leaders or coalition leaders that happens once a month. And for those of you who are staff or perhaps an officer of one of your coalitions, really want to invite you to come to our next meeting, which is going to be on December 16th from 11 a.m. to 12:30. And this is a case where you should send an email to me and Jen Frega if you want to get invited to that and are not currently on the list of people being invited to it. At this meeting, we're going to just really spend some time as a group talking a little bit about what that application should look like, what the criteria should be, and ensuring that we are centering equity, and also the other sort of piece of the puzzle is we want to be sure that the work is aligned with our larger kind of suicide prevention work that we're doing through the YSIP. But our hope is that we're going to create something that's going to not have a giant application that's really takes you out for a week to complete, rather that it will be a process. But the priority is really getting funds to your coalition to do the work that you're identifying as the most important work to happen in your community. The other piece of the process is that folks who receive this grant will be part of an ongoing learning community, coalition learning community. And, you know, we hope to also really be strengthening the infrastructure of coalitions across the state. We know that there's only 3 or 4 of them that have, well, none of them have designated full-time staff, but very few coalitions that have staff people who are actually paid to help staff them. And so these coalitions that do amazing work are usually done doing their work with incredible kind of community volunteer support. So I'm just so thrilled about this, and I think it's really a wonderful opportunity. And one of the ways that the Alliance is working to connect the field and really kind of be an incubator for innovation and change and for moving the work forward. And then I just want to give a quick kind of update. We are right before the long session of the Oregon State Legislature. And as we come towards this session, we have the budgetary report has been that there's likely to be a small recession in Oregon. For those of you familiar with how Oregon's state budgets work, it's really unusual. I moved here from another state, and Oregon has something called the kicker, which I don't know if you're familiar with, but basically it is it's a piece of legislation that is in place that says if a certain amount of funds come in over what was anticipated, some of those funds actually get kicked back to taxpayers. The good news about that is that next year, you probably, as an Oregonian, will be receiving the biggest kickback of your tax dollars that's ever occurred because of how large the income was last year. And I will just editorialize briefly that I think the sad news about that is it means that Oregon has a mechanism that does not allow us to save money when times are rich, so that we have that buffer when times are hard. However, we're feeling optimistic that things are not going to be as kind of desperate as some people had projected. And so we're anticipating a legislative session where there will be probably some discussion of some staff reductions, et cetera, as the legislators look at an oncoming recession, although we have heard that behavioral health is continuing to be prioritized and is maybe at less risk than some other places. So that's just kind of a big picture context. The other thing I would say that's going to be really interesting this session is we have many, many, many brand new legislators. I think it's the biggest overturn of legislators that there's been in 10 or 20 years at the state legislature. And they're also, we also have a brand new governor. And so many of us will be, seeing what it is to have Governor Kotek lead and what kind of tone is set there. In terms of what we're doing as an alliance, the two areas that we are really leading on are, we have our workforce committee. We have, I think, the chair, Julie Schultz here, and Don Erickson, has submitted a legislative concept, and that LC asks the Oregon Health Authority to develop and/or make available trainings on suicide risk assessment and treatment for physical health providers, for CMEs. You may recognize this as a slight shift from what we were originally going to do, which was we were going to parallel the process we had done a couple of years ago, where we had put into legislation a requirement that everybody in the behavioral health workforce has to take continuing education on suicide. Essentially, we got so much pushback from legislators and from health professionals about the timing of adding any new requirement to them, that we just decided it wasn't the right time, and that maybe the more strategic thing to do was to be sure that the resources were there for people who wanted to access them, and also available should we in the future move towards requiring those for CMUs. So that's our legislative concept that we have. The second piece of work that I think is really incredibly important is, and I have to just thank Laura Rose for the work she has done to develop a legislative concept that really looks at getting funding for the lifespan. In some ways, we almost hope that legislative concept won't be needed because it's also those same ideas are also integrated into the policy option package in a lot of ways. There's an ask in the policy option package for, I believe it's about $23 million. Jill, OHA person, correct me if I'm wrong. Yeah, about $23 million for both youth and adult suicide. And, that's a significant ask. And we as an alliance had actually asked them to ask for 25 million. And I take 23 million as a win. And I think our hope is that really there will continue to be energy and attention towards funding suicide prevention in our state. And so we really work during the legislative session hand in hand, both supporting policy option packages, but sort of having legislative concepts also in the process that are available, so that if we run into a barrier one way, we are coming at it another way. And one of my favorite things about the work I've done over the last few years is that I had no idea that ideas could come forward and come forward and come forward. That the first time you get no to something doesn't mean that you can't do something. And so we really believe that while we believe that there needs to be really gigantic institutional systems change, culture change, we also believe in the power of incremental change. And I've learned this from all of you, that if we just keep plugging at these things and really working at them, we are changing the way we're addressing suicide in the state. The other really key issues that we are going to be working on, I think the 988 Trust Fund, this is really looking at how are we going to support this incredible new system of 988 phone calls and the mobile rapid response system that's putting in place to support people once there has been a call. I don't know what the most current version of this trust fund piece is. Let me say that sort of at its core, it has a telephone fee in it that would be part of the cell phone charge. That's how the 911 system funds a lot of 911 services, and we think that the 988 system should have a parallel system. This is probably something we're all going to have to fight pretty hard for, because it's asking for money, and it's actually asking for a mechanism that includes a fee. But I still feel optimistic about it, and I think that it will continue to evolve over the session. There are also a number of bills related to data equity, really understanding what's happening so that we as a state can be effectively doing planning. And in particular, we are looking at partnering in supporting OHA's POP work around SOGI data, which is sexual orientation and gender identity, so we can have better data in that section. That's been a long time recommendation of the Alliance, is that we improve the way we collect those. And then the second piece we want to collaborate on is the Oregon Education Association is actually working to have it become a requirement that schools administer the Healthy Teens and SEED surveys, which at this point are one of the best sources we have for information about what is happening in the lives of young people. Currently, only 32% of Oregon schools participate in that. And it means that the data that we get from that is limited in that way, because we aren't hearing from every school, and we're not even sure quite what it means, like which schools are participating and which aren't, and is there any common ground about all those that aren't? Are the lives of those kids different in some way? And so the executive has really said, yes, we are going to go ahead and support this effort, because we think it's going to make us be able to collectively do better suicide prevention, work towards wellness, really be more strategic and thoughtful in the work we do over time to support youth and young adults. A second piece of area where we're going to be collaborating and supporting is that Basic Rights Oregon has a bill around protecting gender affirming care. And the Alliance has leaned in very heavily around our work to promote an affirming culture for LGBTQ2SIA people and policies and procedures that are affirming, especially given the kind of hostile and really toxic discussions that have happened at a lot of school boards and policies that have been passed in other states. We really want Oregon to be a safe place for everybody who lives here. And we know that this group of my community, of the LGBTQ plus community, has much higher rates of suicidal ideation and suicide, and that we know that a lot of that is related to whether folks are feeling affirmed and safe. And so we are going to support that. And I believe, and Julie, you'll have to correct me if I'm wrong, I believe Oregon Pediatric Society is also working on gender affirming care as a high priority. And then in general, we will be working to support strengthening behavioral health systems and equity related bills. However, there are so many different bills for that what we're beginning to think we're going to do is put some basic concepts together as core values we want to support, rather than try to dive into 15 different bills. And we don't want to dilute our voice and our work on these other issues. So I know that was kind of a whirlwind tour. This is not the first time many of you have heard some of these things, but the work is going to be ongoing. It'll be exciting. And we're going to be hitting the ground running in January. In February, there's going to be Capitol Day at the state capitol. Any of you are welcome to attend that. That is something organized by the American Foundation of Suicide Prevention and done in collaboration with us, the Alliance and Lines for Life. And it's just an amazing opportunity to meet with legislators. We always meet with all the legislators and or one of their staff to talk about our suicide prevention agenda. Additionally, I will be setting up particularly visits with folks who are on the committees that are the priority committees, looking at the legislation we're advocating for. And any of you who are interested in joining me or yourself as a local coalition, going out and organizing to speak with your particular representatives, we invite you to do that and to join us. So with that, I'll pause for a second, see if there's any questions folks have. And then it'll be time for a 10-minute break.
We do have folks from government relations on the call as well, if there are questions around the policy options package and specifically around how do you all advocate for the policy options package, which is the funding, the 22 and change funding requests. So just want to name that we've got some smart humans.
Actually, Jill, thank you. I didn't realize they'd gotten here. So thank you for saying that. I would love, I personally would love to hear a little bit about that. Just it's been a little mysterious to me about the most effective way for us to kind of jump in and help with the policy option package, and whether that entire giant package goes before one committee or if it's split between different committees, that kind of thing.
Hi.
Oh, go ahead, Ashley. Sorry.
Okay, great. I'll jump in just quickly to say hello and then pass it over to Cynthia and others. But hello, everyone. My name is Ashley Thurstrup. I've actually been to the Alliance to speak with you all. I'm trying to remember, maybe 6 months ago, around our commitment to supporting LGBTQ plus and particularly trans young people, and just really delighted to be here today. I'm in moving into a new role as the interim government relations director for OHA, working with this fabulous team, and just, yeah, really excited to work with you all on throughout the next long session. And yeah, specifically to your question around how this POP might be moving forward, I think we can answer those questions. Just so everyone is aware, we can put a link to all of the OHA policy option packages and legislative concepts, which are posted on our website, so you can take a look at those. We won't know for maybe a couple more weeks exactly what's going to be in the governor's budget. And that's when we'll know if this full POP is moving through. And at that point, if it's in the governor's budget, it becomes an OHA priority and we're able to advocate for it. So I just wanted to say that, because that's the caveat of just not quite knowing with the new governor transition, and things are maybe moving a little bit slower maybe than they would in a typical legislative session. So yeah, pass to you, Cynthia.
Thank you, Ashley. Yeah, so thank you for that intro. Now, let's say that it was a typical day, and what would I say, right? So what I would say is have small conversations about this with legislators. It's not like a committee bill where there's like a committee and then there's a hearing and people hear about it. That's not kind of how a budget works and policy option packages. So it's really important to talk to either your legislator or legislators that are on a committee that would care about this. Well, I shouldn't say all, probably all legislators care about youth suicide specifically, but I would say ones that would advocate, have conversations with them, write them letters, talk to your legislator. There, I'll put a list on there, but you can easily see who your legislators are. You should have two, one a House of Representatives and a senator. So you could talk to them. They usually have, well, they all have the offices that are closer to where you live, so you can talk to the office staff. Please talk to their legislative staff. You don't actually have to talk to the legislator. Their legislative staff works with them very, very closely. So that it's perfectly fine to talk to their office, to the legislative staff as well. For a budget, we kind of don't know what we get until at the end. So really important to advocate. You have the whole session to advocate for this. So please do not be shy about having those meetings. Legislators actually do want to talk to constituents. They would love it. They want to hear what's going on, what is the pulse of their district, what is the pulse of issues. So just have conversations. Keep it short. You don't have to like write an email that's like an essay. That's really hard to read when people are getting 200 emails a day. So keep it short, to the point, make sure your passion goes through. Those would be the points that I would highlight.
Thank you.
Yeah, I'm just going to jump in here real quick. I'm Colleen Benson. I'm the behavioral health legislative analyst. I've only been here a few months, so kind of lean on Ashley and Cynthia quite a bit here. But I just wanted to just say, like, if there's other questions or support that you need, you know, please do reach out to us or ask us. You know, we're all here to help.
Thank you. Sometimes we get asked ourselves, like, here's the legislative concept and how much is that going to cost? And it's very hard for us to figure out what that fiscal would be. Is that something you would ever work with us on?
So that's tricky. So especially like during session, we do price things that come to the floor out. We get asked for something we call a FIS, a fiscal impact statement, and that's kind of the way. So it's tricky, especially with the timeline. Sometimes our budget folks have during session are just incredibly hard to price things outside of what is requested, just because of the workload amount that session does produce. We do get a lot of bills in the thousands for long session to price, so it gets tricky. So we wouldn't necessarily be able to price something, especially during session, because of the workload that we get. So go ahead, Ashley.
Yeah, I'll just jump in. And that if there is a like kind of direct role for OHA, we would always be pricing that, and we could have that conversation with you. And I think earlier is better, it's great. And we would be able to give a ballpark and then do the formal FIS maybe later. So
okay, Ashley, we definitely have one of those. So that's great to know.
All right, so it sounds like there's tons of great conversation around this. Do you think we're ready to let everyone have a break, Annette? And potentially, if you have more questions or comments, throw them in the chat. Lots of great interaction going on in the chat as well. Are you good with that, Annette?
Oh, yes, thank you.
Perfect. All right, so let's have everyone come back at 11:28. We will see you back soon.
Thank you.
Annette, can I
Yeah.
just tell you that I have a really basic slideshow about the POP that you can just send out in the
Oh, that would be
and how it aligns to the Alliance's requests. And then there's just like really basic talking points. It's not fancy, but it's
Yeah.
but if people are particularly around Capitol Day, if people like having
that would be really helpful. We're putting together a double-paged one-pager, but the POP is just one of the things in it. So having one that's specifically the POP would be a great resource.
yeah. I will send that to you to send out. And if I might take 3 minutes to just like fly through it before I go to the YSIP initiatives, just because I want people to one of the things that is seems abundantly clear to me in whatever hazy clearness exists in the world, but is that like the messaging around like this is the Alliance's ask. It's coming from community input. It's not OHA's in a vacuum.
Not like you're just asking for more staff because you want to
right.
build a right.
And I don't think others have that. And so I think making that be front and center is going to be a strategy to use.
I believe that is true. Thanks.
Hey, Annette. Nice job on pushing back on that grant stuff. That type of stuff needs to happen. So
thank you. Well, that was definitely a group effort, and it's amazing to see. We can't always expect that, but we've actually had a fair amount of success when we've really pushed back on things.
I mean, it's important. It's part of the problem, actually. It's too hard.
Yeah, exactly.
Too many rules, and even the smartest of smart people. It's like, I'm not doing that.
Right.
It's too hard.
Right.
So thank you for doing that.
Oh, thank you. Thank you.
Can I mention something else, Annette?
Oh, yeah.
Just, I've been seeing some of the reports, and it's surprising to me to learn, I guess, the extent of, they say there's a trend with the folks having long COVID symptoms or diagnoses, increase in suicidality. And so I think that's something to also keep an eye on and be aware of and strategize around.
Oh my goodness. I had not heard that, Laura Rose. Thank you. I mean, it makes sense to me, but because chronic illness has that intersection.
Yeah, there's quite a bit. I could fill you more in on it later, but just something to keep in the awareness.
Okay. Okay, folks, I'm going to run and take my own little break here, but I actually love these little between conversations. They're very helpful.
Jill, I thought it was funny to see so many Jill Bakers because I was letting people in and I was like, what's going on? Is Jill having trouble? Then I'd see you on here and then more Jill. I was like, oh, that's funny.
That was hilarious. I think that because you have to register for the meetings, I think they just use my registration link. But I know it was I couldn't figure out what was happening either. And then
I'm glad to see so much of the OHA SPIP team here. I know you all have been so sick this week. So thank you for coming.
I mean, sounds like along with everyone else, so
Yes.
we're all in it together.
Definitely have been. So we'll start at 11:30. It's just about a minute away.
I'm hoping everyone's break has been refreshing. I did a new coffee, which I usually only drink one unless Michelle is feeding me her special coffee, and then I want 20, and then I'm jittery. She makes the best espressos at home, or whatever she calls them. I don't know. Okay. So we're giving it another minute, Annette, it sounds like.
It just hit 11:30, so I think we can go.
Perfect. Okay, so I'm gonna move forward then with our next agenda item. So welcome back, everyone. As I said, I got another coffee. I hope your break was refreshing. I'm actually going to turn this over very quickly to Jill, our Oregon Health Authority Youth Suicide Prevention Coordinator, to hear about updates and new YSIP initiatives.
All right. I'm actually going to loop back to the POP conversation just for a hot minute.
Perfect.
Just to show you, and this will be, I did not send this out to Annette ahead of time, so it's not in your meeting materials, but will come in the follow-up. So naming that our number is number 446, in case, let's get that in our head, that I think that will remain our number throughout. As far as what the policy options package is around suicide prevention specifically, naming that about a year ago, 10 months or so ago, the Alliance, you all gave us funding requests to think through, and that talked about the low barrier grants for suicide prevention coalitions. That was one of them. Some things around having some staffing to support the workforce training bill that passed in 2021. Full funding for a lifespan approach to suicide prevention, and then around mobile response and crisis. So our POP number 446 includes these pieces of that. So it doesn't include mobile crisis or stabilization pieces in the suicide prevention specific POP. But as if you clicked on that link that we put in the chat around all of OHA's, there is funding from the Children and Family Behavioral Health and some mobile crisis pieces as well. Our 30-second elevator speech is that it's this POP will mean that the YSIP, the Youth Suicide Intervention and Prevention Plan, is fully funded, and it allows us to launch what we think is about the first 2 years of initiatives of the Adult Suicide Intervention and Prevention Plan, calling out for you all specifically that there's funding included in the POP for staffing for the Alliance to become the advisory group for OHA around the Adult Suicide Prevention Plan as well. On OHA's side, it creates a suicide prevention unit. So right now, there are 5 of us with 4 different managers in 3 different units. And so it creates a suicide prevention placeholder with a manager, our own data person, that workforce training person that you all requested. And then Shanda and I are both youth suicide prevention coordinators. So we included another adult suicide prevention coordinator to work alongside Deb Darmada as well. The bulk of the funding in this POP puts local coordinators throughout Oregon. So the bulk of the funding actually doesn't come to OHA, it's going to communities. And that we feel really good about our specific equity work and equity focus throughout, kind of woven through. So the number is 22 million and change for a biennium, and that would be an additional to what we already to what we're already funded at. That's the link to that was already put in the chat, and this lovely Buddha doodle, which matches the like, what's the next right step? That this is a big step forward if we would get this money. That's it. I just wanted to level set it for you all there. Annette, can you, or Charlotte, can you tell me how much time I have for the YSIP 2023?
Absolutely. You have until 12:05.
Okay. All right. One of the 2023 initiatives is that OHA and the Alliance will work together to try to move that policy options package forward. And so naming that all of the work that's included in that POP or in that policy options package funding request will be added to. And so what I'm going to talk about now for YSIP 2023 is what we know we're going to do. And so the only thing that we know related to the POP is that we're asking for it. And so if we get that funding in June or July of 2023, our list of 2023 initiatives will balloon, essentially. Okay. Doing the thing where I talk to myself. Oh dear.
It's up.
It's the right one now?
That's the POP one. There you go.
Good?
Yep, perfect.
Okay. All right. So I'm going to run through kind of an overview of where we've been and what we do as a group collectively together, and how our work is laid out in a for starting January 1 in 2023, kind of what our collective impact and work will look like. Just as a reminder, all of the things that we'll be talking about specific projects and initiatives that we're working on fit within the Oregon Suicide Prevention Framework, and that there's an interactive PDF and a video explaining the framework. That the hope is that we can see all of the work lifespan, youth and adult suicide prevention, including some of those shared risk and protective factors around social determinants of health embedded in the framework. So what I'm talking about today is this outer layer, strategic initiatives. These are the things that we collectively, and I'll talk about who we is in a second too, but these are the things that we collectively have said are the most important projects for us to work on in the year 2023. And so just naming that the list does not include everything that we possibly could do or should be doing. It's the things that we are prioritizing as the next right step as a collective of humans who care very deeply about this work. This, just to level set, that in 2021, 2022, so we issued kind of our list of strategic priority initiatives or projects in the middle of 2021, with the commitment and promise to check back when 2023 rolled around to see where we were at. So just as a reminder that there were 117 initiatives listed in the list that our project tracker that we're looking at right now. That of those 117, about 60% of them are complete, achieved, they're going, work is happening on them. And then the percentages that go down from there around things that are kind of really early, we're just planning, and some things that are in progress, but we're not yet done with. And just to remind you all that in the list that we're currently working on, that 97 of those 117 were OHA led, 15 of those were Alliance led initiatives, and the others were assigned out to other entities, Oregon Department of Ed, University of Oregon, some others. This is again talking about where we are right now. How did we do in 21, 22? So we made our list of 117 things. And this is just about deadlines being met. So about 80% of our deadlines of the initiatives are on track to where we thought they would be. So we might still be in the planning stages, but that's what we thought we would get to. About 17% of them, or 20 of those initiatives, we are behind on in some capacity or another. That is mostly on track, but we're not meeting all the deadlines. And then 3% or 4 of those initiatives are stalled, and that we don't think that it's going to keep going, and or we're way behind on deadlines. Again, just level setting where we have been. I'm not going to go over this because I've showed this to you, I think, in every quarterly meeting since we started. I just want us to remember that we're building on work that you all have poured so much time and energy into, and kind of naming that we changed our process from the first iteration of the Youth Suicide Intervention and Prevention Plan to try to get better at doing this together with an advisory board and OHA collaborating with way more intention. This is just a reminder of what this fall has been like. In September, I showed you some of these same things. I said I was going to check with each of the committees. I was going to check with some other advisory groups and state agencies and gather their recommendations and come back to you at this meeting with a first draft of where we're at with YSIP 2023. Just as a reminder, I feel like I've said that 16 times. Another reminder is that we're planning to do this annual adjustment each fall and issue a where we're at, what do we really realistically think we're going to do in the next year for the following calendar year, so that we can maintain a current list of priorities. And you'll see how much has changed in the last 18 months already when I get to the slides, but to make sure that we are adjusting accordingly. It's not meant to be a complete pull the rug out and wipe the slate clean. It's meant to be more of, I keep thinking about it as a chiropractic adjustment, that it's more of where do we need to align and get back on track, and what's the next right step. I will name again that it is not the intention to create a comprehensive list of everything that we could be doing or even should be doing, but that we're asking ourselves what do we want to start, stop, and continue in this next year from each of our lenses. And so if you are a person who is on this meeting and has not been involved in Alliance committee work, the Alliance initiatives that you'll see in the YSIP 2023 come from committees. And so in this field, everyone carries so much passion and good ideas about how to do suicide prevention and what the next right step is. And so we have kind of a process to make sure that those ideas go through and have the ability to hit the air in a group with others who care about the work as well. And then those collectively are passed forward and included in the plan. Okay. That is the numbers. So we went from 117 action items to 159 action items. Before you have some sort of medical event with stress that might be happening in your body right now, I just want to name that I'll kind of summarize some of the things why it ballooned so much. And part of the reason why it ballooned so much is that we're trying to create links to other good work that's happening. And so it's not all, now you all are in charge of 60 more things to do. We're telling the story about what's happening, I think, in a more comprehensive way. And so many of the new YSIP initiatives are not new work. and or their work that is new but is already included in it was the next right step that you all identified in your contracts or in your committees or in your state agencies, depending on your lens. So 13 initiatives were removed. I'll go through and kind of talk through what those are. Largely around things that were time limited. So rules will be written for this legislation. Rules are now written. That initiative comes off. Pilot projects for the safe storage, that was a piece that is included in the policy options package request to put more funding there, but we don't have funding right now. And so it came off the list. There's not a pilot project happening. And so that came off the list. Many of the initiatives were just kind of reworded for what the next right step is. 44 of them will have slightly different wording around in the initiative to better match kind of the current reality. About half, or 51, of the initiatives are exactly the same. So one of the things that that the OHA suicide prevention team has talked about is how do we, rather than just having it balloon each year, do we have a separate list that's the stuff that is sustained and achieved and going, and so that we can have kind of a more concise list to look at about what we're actively working on. Right now they're all together, but just naming that that's been a discussion. And then 60 are new initiatives, things that that were the next right step across throughout the framework. I'm assuming somebody else is monitoring the chat and will interrupt me. So what did we do better, I think, this year? Knowing that we're just doing the next best thing that we can, that we, as we get better, think of. I think we did a better job at the process for feedback from you all, from the Alliance committees and work groups to say, here's what you said you were working on in 2021, 2022. What do you want to start, stop, and continue, and to be able to map those out and embed them within the framework. You'll see on the list more lifespan work that impacts youth and also older adults, including some initiatives of Megan Crane's work in the Zero Suicide in Health Systems, Health Settings grant, and then some of the impacts of Deb Darmada's work that's coming given the new CDC grant activities. So not all of the Zero Suicide and not all of the CDC grants are listed in the YSIP 2023. The ones that we identified would have lifespan impact are. We did a much better job of including what our state agency partners are doing in Oregon Department of Human Services and Child Welfare, in Oregon Department of Ed. So the works that ties into suicide prevention, naming the work as the state work as well. And then I think we did a better job of naming the suicide prevention specific initiatives from other OHA work that are not just Deb, Taylor, Megan, Shanda, and me, but that are specific to suicide prevention. I'm going to show you, it's hot off the press. It probably still has typos on it. And I'm probably not going to keep it open. Like, I'm going to give you the link to the smart sheet that has the 2023 initiatives and keep it open for a week or so, but it's not ready yet. You're getting a first behind the scenes look. It will be ready January 1. But so I'm naming that. Here's some things that were new adds to the priorities list. So like I said, the 60 new initiatives, some of that is stuff that already is happening. Things like I named the work around mental health prevention and promotion funding that comes from OHA in the Coping and Connection section of the framework. That is not new. That's been around for a lot longer than I've even worked at OHA, but we didn't have it represented. So that is a new initiative that's really not new work. These pieces are going to be new work in the 2023 priorities list. So one thing that you'll see is a 3-hour training for traditional health worker workforces, including peer workforces. A free online on-demand training for that workforce that it specifically links the intersections of problem gambling to suicide as well. So that's a piece that our friends in the problem gambling section of OHA had some funding for, and we're willing to support that. That was a request that came out through the Rules Advisory Committee process for House Bill 2315 around requiring training for behavioral health workforces and suicide prevention. We're getting ready to ask for bids and fund some work around Latinx considerations for suicide prevention. Again, we're looking at making sure that that training is available online, on demand, and then also some in-person pieces. We're really excited about that. We're in conversations with OCUSP, which is the Oregon Colleges and Universities Suicide Prevention Project, including Portland State University, University of Oregon, Oregon State University, and I think 6 others are part of that coalition. They used to have funding, they don't anymore, and they asked for some funding support. So that that piece will is included in the Let's Get Better and do something better for our colleges and universities in 2023. Critical incident and stress management is a training that our post-pension response teams have taken, and we have some work coming in 2023 and beyond to increase the availability of that training and to get more folks trained up. The mini grants that Annette already mentioned, and then linking to, so our team, the suicide prevention team, is not directly in charge of 988 mobile response or stabilization services, but all of them are just wildly suicide prevention. And so naming some significant progress in each of those categories, significant work to be done in each of those categories. Okay. We're going to go on a tour of a Smartsheet. How excited are you? If you want to find your clap emoji, you can. Just kidding. I think I'm the only one in the world who just loves Smartsheets so hard. I will also, like I promised, put the link to this in the chat. Right now, it's kind of like a Googly Doc where you can give people permission to look at it when you want to. So I'm gonna you all have permission to look at it right now. I'm just naming that I will close. I'm not gonna leave it open until it's ready. Because I'm a control freak, I think maybe is the answer. Okay. This looks very similar to the YSIP 2122 Smartsheet. I copied and pasted over the framework levels on that first column. The second column includes the list of things, the 159 things that we are going to prioritize and work on in 2023. The bolded initiatives are new, so there should be 60 bolded initiatives to showcase the work. I would like to just highlight over here a new column called Population Focus. And so if you click on the 3 dots to the right of the column, I think you have this functionality in the view only. But one of the things that I promised to try to get better at was to be able to talk about sectors and populations that were like, what are we doing for 18 to 24-year-olds? What are we doing connected to tribes? What are we doing for LGBTQ youth? And so this is a first it's imperfect. It's a first attempt at being able to do that. So for example, I can go down to filter and show you for the category. So I'll just show you the categories here first.
And Jill, I'll let you know that Laura says the link isn't working.
Okay.
It says you have to be a member of the list owners.
Or organization is what it said to me.
Try it now. I'll put it in again just in case.
That's working.
Okay. Okay, so the populations of focus. Here are the current categories. LGBTQ, 2SIA+, 18 to 24, under 10, lifespan, Latinx, Black, African American, American Indian, Alaska Native, lived experience, health equity, K-12, post-secondary, workforce, health systems, system-involved youth, youth with disabilities, and law enforcement. So naming that those might not be the right categories or the categories that will live in perpetuity, they're the categories that are a first pass to be able to filter. So I will just show you that lifespan and 18 to 24 in lifespan, just to show you that of our 159, 61 of them are in lifespan and or address our young adult population. So it feels good to me to be able to know that and to say, here are the things that we're doing for that population of focus. Similarly, I'll just show you lived experience. So 71 of our 159. So the rows are more because they have the framework levels as well, but 71 of the initiatives address lived experience voice and or our lived experience specific initiative.
I just want to name out loud that filtering is a new process we're just really freshly leaning into. So as you sort those and play with it, you might be like, what? This one should really be tagged that, or that one really shouldn't be tagged this. That's going to happen because we're just figuring out how to best sharpen that. And you might be like, why don't we have this category? That will be normal in this moment because it is not a fine-tuned process as of yet, because we had to start somewhere.
Yeah. You can also sort by who is leading the work. And so that is the opportunity to know kind of what is the alliance, what are the alliance specific initiatives. You went from 15 to 23. An example of that is one of the initiatives that we had last year, and this is true for many of the ones that kind of ballooned from one to many, is that we had kind of squishy initiatives. Like you had one that was named the Alliance will continue equity work and make recommendations or something like that. And you can see that that kind of umbrella initiative has some pretty specific ones that are the next right step for 2023 around an equity screening tool and forming a BIPOC caucus, those types of things. So naming that that part of the balloon was because we know what our next right step is in some of these categories as well. What questions do people have? I want to name, yes, someone who is unnamed, Samsung.
That is me, Kirk Wolf, child psychiatrist. Yes, certainly appreciate your presentation. We know that boys and men are 4 times more likely to die by suicide. What specific initiatives do we have to address, that fact?
Thank you for the question, Kirk. I will name that. Here, I'm going to look at people's faces for a second. So I want to name that my wording here is not well polished, and so I'm going to just speak as a human from my heart and assume that and ask that you assume good intent. It could be stated that the whole world is focused on boys and men, and that many of the initiatives that we have listed, all of the initiatives that we have listed impact boys and men as well. That the gender binary itself feels problematic to me, to create a tag saying this is a men's initiative. Another thing that feels problematic to me is around when I think about suicide prevention and what the strategy should be around suicide prevention. It feels really similar to me about saying, like, what are we doing for white people to have that tag? And I know it's not the same, but from my heart, it feels weird to create that designation. And that when I think about suicide prevention specific to what we know about suicides in the problematic gender binary of men and boys is what are our strategies? It's around firearms, that we have firearms specific strategies listed, that it's around being open and accepting, anti-stigma, breaking down silos of shared risk and protective factors around naming hard things and being able to talk through them. And so just very transparently, I made a decision not to create a specific filter that tagged boys and men. And I look forward to thinking through what's the next right step there.
I think we're missing the big picture. Boys and men, 4 to 1 more likely to die by suicide. We can also look at jails and who's most likely to be in jails. We can look at graduation rates. So I think until our state really focuses specifically on youth suicide prevention in boys and men, I think we're going to be missing an important part of the big picture.
Thank you for your perspective. And I see lots of strategies that will have a positive impact on boys and men when I look at the list, and I hope you do too. Julie?
Yeah, this is such a rich conversation. So Kirk, thank you for bringing it up. It's an important conversation for us to have. And it's an important conversation for us to explore. Is my internet okay? Okay. For us to explore new ways of thinking about gender specific risk and impacts of risk. And so, for example, and I'm not by far an expert on this, but for example, if more boys and men die by suicide or attempt suicide with firearms, if we address firearms, we're impacting boys and men issue, and recognizing that boys and men are not the only ones who die by suicide, and boys and men statistically captured in stats may very well likely not include non-binary high risk. I mean, because our data collection around gender is so flawed, and we're all learning a new way to do this. So I really want to applaud continuing to bring things up. I do the same thing when they're my kind of passion piece. But I want to say I think we are doing a both and here, and making sure that if we can, Jill and team, identify which non-gender strategies do impact most, do impact gender specific risks, then I think that would also help weave this very complex conversation together. Thank you.
Thanks, Julie. Charlotte?
I just wanted to kind of support some of the things that are being said here, and thank you for bringing light to some of the very important things that we think about when it comes to suicide prevention, which is reduction of means and methods. And so I love that you brought that into light, Julie, because gender is a complex issue. And one of the things that I always worry about with any group who we would consider at higher risk for suicide, whether it's statistically supported or not, is that if we are primarily only putting a huge amount of focus there, then we're also missing a huge population of people who are still at risk. And so I love really personally how you worded it, Jill, to really highlight how all of these interventions are geared towards our community as a whole. Regardless of what your gender is, the hope is that these would make impact. And in light to what Julie said, you know, in the state of Oregon, over 50% of the people who die by suicide are actually by firearm. And so I just want to call out the effort and energy as well that our state is putting towards, you know, that upstream prevention, even looking at things like adding Oregon Counseling on Access to Lethal Means to the Big River, and really bringing it specific to the state of Oregon. And that in itself is an upstream approach as well, because in that training, it really does talk about having these conversations even before risk. So I just wanted to highlight all of those great things that you mentioned, Jill, that these prevention efforts are meant to really gear towards anyone. And we also have, you know, a lot of knowledge that there's specific population too, but we want to be, I feel like, careful to make it too narrow.
Julian.
Jill, I just want to applaud you because I really like everything that you're saying about the gender binary and what you want and your plans to do this and your work that you do around it. I think that, and especially teaching like things like sources of strength, where we talk about gendered things a lot. And I think that like just kind of dismantling gender binaries is like really beneficial to people who identify as men and boys, because part of the thing that we teach a lot is like, and I specifically say is, for example, for aggression and impulsive behavior, that it's not necessarily only focused on, you know, those who are born males, right? It could be those who I also identify as men as well. And so I think that conversation of like selectiveness of gender, I'm opposed to, basically because I could see how it really kind of goes back into transphobia and things like that, especially so there's that. And then my other thought, and I just want to, you know, speak my truth in this space, so I'm thankful for everyone hearing me, is that the gun laws, especially going on in like our last voting measures and things, it's a very complicated conversation, and it really does include racism. So I would really like everyone to kind of look into what that looks like for brown folks in Oregon, what measure 114 could look like for those people. That's all I really want to say. I'm kind of activated in some way, but I just want to appreciate what you had to say, Jill, because I love the work that I do, and I'm here to destroy racism and gender binaries. So yay.
Thank you so much for feeling like you can speak up in this space. It is a safe space, and we embrace that. So thank you so much. It's really meaningful. Annette, I see your hand up.
Yes, I just wanted to mention this is such a rich conversation, and actually our last small group exercise was going to be thinking through issues of equity, et cetera. So it feels on course. So I don't want to chop it off. The other thing I want to say is that at our March meeting, we're going to dig more into this issue specifically, because we've had a number of folks on the Alliance bring forward this concern around, are we really thinking through this issue appropriately. And so I think that we will be hearing from some interesting groups that have done work specifically to reach specific populations of men or people who identify as male. And there is so many nuances to this conversation. I appreciate the way that this group is treading into it. And I don't want us to be scared to have the conversation. And I think, so just to let folks know, next meeting we'll have an opportunity to dig in some more around it.
Yes, thank you. I just want to call out, as Annette saying, to this space, you all are doing an amazing job having these difficult conversations and really respecting and embracing everyone's perspective. I do want to make sure, Jill, because this did get, everybody really jumped into all this work you're doing. And I wanted to comment on some of the comments in the chat saying how beautiful the work is and how organized and amazing it looks. And also give you an opportunity to go ahead and if there's anything else that you have left to share for your presentation or bring it to closure.
I don't have anything else to share around the presentation. I hope you all know, like, I'm having feels that how beautiful that we can have these conversations, how beautiful that we can disagree about, have so much passion that we can say, like, here's what I think is best and here's what I think is best, knowing that we're all in a room because we care deeply about this issue, and that we don't, and that our common goal is the same, and we can have passionate disagreements about how to get there, and that's okay. I'm not scared by that. We're not scared by that. It's a result of human humanness and human care about this really important topic. And then maybe I'll just close by saying, gathering 3 months of what's the next right step has been a beautiful process to get to facilitate and shepherd. And I just, like, I will say this time and time again, I just think that Oregon's a special place. We've got a special group of people in a special room to do this work. And I just, like, I believe in it, and I believe in us, and it's a freaking exciting list to look through, and it's so protective, and it will save lives. So thank you all for going through yet another OHA process.
Thank you, Jill, for your great presentation, for your authenticity, and for your transparency, bringing yourself to the table, and always doing amazing at guiding through what can sometimes feel like difficult conversations. I'm going to go ahead and pass it on to Annette.
So thank you all. I'm always just amazed how folks are staying here past noon on a long meeting. We're going to break into small groups to get to talk a little bit more. Let me pull up my slide to remind myself what it is. I got too distracted by our whole conversation. Let's see. Okay, let me share my screen. We're going to do a small group breakout, and each group's going to have one of the principles that's part of our equity screen. There's 5 principles in the equity screen. We'll be spending more time on these principles over the next year as we really look at how they move into our work. But we're just to ask you in your groups to reflect on this update and conversation we've had about the YSIP and how are we putting this principle into action. And what more could or should we do in this area to advance our work? We're going to ask you to share your answers on sticky notes on Jamboards. And we notice it's really helpful if somebody is willing in the group to step up and be a facilitator and sort of help encourage everyone to be part of it. So Maria's going to help us move into groups. Maria will also be available as a resource to folks if people have any difficulty with how to manage the Jamboards. So, and I think what we will do is we will do the small groups, and my proposal actually would be that we don't come back together as a large group, given that we're where we are in the agenda, that we exit from the small groups. And I just want to thank everyone for this incredible, thoughtful discussion, and ask you to take some good notes in your meetings, because we really hang on to those, and that's going to inform our ongoing work that's happening with our equity committee. And keep your eyes out soon for an invitation to the group that is going to be the BIPOC caucus, and also for an invitation to White Accountability Learning Community, which is going to work on walking our walk and talking our talk, and really continuing to educate ourselves once a month. So we're going to go ahead and break people into your small groups at 12:30 if you can close from your group, and we will collect your notes then. And I'm going to hang on here in the middle if there's anyone who needs to check in with me about anything.
And when we break you all out, I will be hopping in, so bear with us. To give me a minute, I'll be hopping into each group to give you your unique Jamboard link, and you'll have your principle to focus on in there, and the question will be in that Jamboard. And I'll also post a question here, so you have that as well, but just be patient and I will be popping in.
Would imagine Tim probably. Oh, we're recording these too? I didn't know that was a possibility.
No, just so you all know, whenever I pop in a room, it's because the recording's going to follow me. So when I leave,
recording.
That's
Yeah.
funny. Okay, good to know, Maria.
You're like, oh man, don't want to say anything that I don't want recorded.
Okay,
No.
so here is yours. You're in principle 1, and I will be leaving now. And the question, again, it should be in there.
I can do the Jamboard. I love these things.
Yeah, and on the left, it's the 4th one down is the icon and the link to add sticky notes.
Beautiful. Do we need to have a different frame, or can we just throw it all on?
All on the front one works. If you need additional sheets, that's fine.
Got it. Okay.
Period.
Right. Yep.
Yeah.
Wondering.
There it is.
Hi, everyone. There's the link to yours. Oh, it's going to show to everyone. I might as well. Dang. Your principle 2. And the question should be on there.
All right.
I'll stop recording. The recording follows me into the room, so don't worry. I'll be leaving now.
Okay. Thanks, Maria.
Really important. You can turn the recording off, probably.
Looks like Jacob came back in.
Or well, not, she's 11 months old, but that's Harper.
Very cool.
Yeah.
So
Hi,
Maria, we're not sure what we're doing here.
This group needs
Yes,
help.
hang on. I'm giving you your link, and you are principal 3 in this room. So you'll be able to use that link and add your comments according to that question on there.
Great.
And when I leave, you won't be recorded anymore. It just follows me. So you know.
think that I honestly think, I mean, that we really are going to spend a lot of our next meeting talking about this topic, because I think there is not consensus in the group about,
including men. It's
I think it
Okay,
was.
all of you, you are principal 4 and popping that in now, so your group can focus on principal 4 and just add sticky notes on it. And don't worry, the recording follows me, but when I leave, this won't be recorded. So you know.
Thanks, Maria.
Risk for suicide is the culture and the patriarchy that has historically
time, but we.
Hey, Maria. Hello, I'll be putting in your link. Let me see here. You are principal 5. And so you can focus on that. And then I'll be leaving. The recording will follow me when I leave, so don't worry about that piece. But there you go. Principal 5 for this group.
Yeah.
Well, I also encourage us, you know, I think that there's a lot of focus sometimes on, I just want to comment to what you said, Jake.
And then how advocating for ourselves kind of creates that culture of like everyone doing so, and then therefore like in that way can change and challenge like systems in place. And
hello all. Sorry,
Hi.
I'm not trying to interrupt you. You are all on principal 1, and since we have a couple groups doing that, you're 1A, but just this is your link to go ahead and go to that and post some notes on it. And it's on the left of the Jamboard, the 4th icon down is where you add sticky notes. So I'll be leaving you, and when I leave, the recording part leaves with me, so don't worry about that piece. Thank you.
Okay, thank you.
I feel like Oregon is a place where it makes sense for us to try and sort some of that through.
Sure.
Group, so maybe this.
Hello, everyone. I'm getting
Hey.
your link specifically in here. You're going to be focusing on principle 2. We have a couple groups doing it, so you're 2A. So use the link I'm sending in right now, your group 2A, to work on this. Try to get to what you can, and the links stay on even when we leave the meeting, so you can add to it if you'd like as you go, or if you have to get off, just know that link's there. And then when I leave, the recording will follow me, so you don't have to worry about that part for your group. And then on the left side of the Jamboard link, there's there's multiple icons. 4th one down is how you add sticky notes. All right, I'll leave you to it.
Maria, where do we see our link?
It should be, if you open the chat, it should say Principal 2A for your group.
Oh, I see. Yeah.
Okay, I'll leave you to it. Thank you all.
It's poor Maria. Every time you pop in or out, it says recording on, recording off.
Hi all, here's yours. I'm popping it in. You will be working on principle 3, and there's a couple groups who are doing 3, so you're 3A. So in the chat, you just click on principle 3A for this group and do what you can. And even when the meeting ends, if you want to spend more time, the link will still be open for you to add things or get back to it, but just so you have it. And then when I leave, so you know, the recording will stop. So go ahead and do what you can in the last few minutes here. Thank you. Bye.
Bye, Maria.
Thanks.
LGBTQ plus people at my company, a monthly get together. So it's my first one going. So I was just invited. So I'm going to go to that.
See you too.
Hello, everyone. I'm putting in the chat right now. You guys will be focusing on Principle 4A. So that should be in the chat now. And then when I leave, the recording will be off anyway for this group. And on the left side of your Jamboard, it'll have the 4th icon down, should be the sticky notes you can add there. And when the meeting ends, you can still continue if you have more thoughts or add to it. The link won't shut down, just so you know. I know we don't have that much time left, but there's the link for you all. Thank you, and I'm leaving.
Thanks.
Thanks, bye.
So I did injury prevention for a long time, and trying to pull and look at that.
I don't think so.
Yeah, look it up. It's really good.
Your group 5A, I just put that in the chat, so that will be the link you're going to want to open up. So 5A for this group, and we have 2 groups that are focusing on Principle 5. That's why you're 5A, so you can get to it. And on the left of your Jamboard, the 4th icon down is this, how you add a sticky note. And then, of course, we don't have much time on this, but you can continue to add to it. It'll be left open even when the meeting ends, but you can add to it as much as you can to those thoughts. I'll be leaving you now. Thank you.
Like very broad, and so should I just continue kind of with the broadness? Like, what should I do?
Let me tell you, Julian, this is a case where there's no one way.
Yep.
You do it however you want to. It's more like we're continuing to, we're really growing in this equity work. Okay? We're just kind of digging in. Sometimes it's kind of messy. So just go ahead and share whatever you feel like is most important.
Yep.
We want to be sure we hear. And we have an equity committee, which, by the way,
I'm sorry, what was that?
We have an equity group that meets once a month, which and we're going to have our BIPOC caucus. So we'll bring like the feedback back to that group.
Yeah, I saw that Canada mentioned that they were part of that, and I was going to message them and say how I was interested in learning more. So
yes,
Julian, that's
they're not here now, but I would like to connect.
Good.
Yeah, that's amazing. And yeah, just putting down your thoughts. I feel like sometimes equity, when you're considering the questions, can just feel complex in our mind, period. So I think that is kind of the goal, is just getting everyone's thoughts and bringing it together and seeing how do we think about it, and then taking those thoughts and how do we inform our work.
Okay, and y'all have the link to this Principle 1 thing, right? So if I can just keep adding it, I might add more information with feelings and thoughts.
Jacob, did you need to be added to a room? No, okay.
Also, Annette, were you gonna say something?
I was just gonna say, Julian, I'm so glad to have you join us. Are you on, do we have you on the listserv and everything?
The list what?
do you get emails from us a lot?
No.
Okay.
Yeah, and this is your first time, Julian, right?
No, it's funny. I think this is my second time, because I think me and even my colleague Sky, we were like, this actually feels familiar. Maybe we're getting it confused with the Big River meeting that yeah, so I think we both have been, but
I just would say
only ever been once.
Give us your email so that we can start adding you in, and you'll get things like hear about the equity group and the BIPOC and all that stuff. I want to be sure we get you connected in.
Yeah, how can should I just put my email in the chat or something again?
Stick it in the chat, that would be awesome.
Okay, cool.
And we're at 12:30.
We are.
Yeah.
I let people know, because I know there wasn't much time, that they can continue adding things if they wanted with that link. The link won't shut down even though the meeting might end. The other thing I wanted to point out to you, Annette and Charlotte, is that, when I set up the breakout rooms, we had the full list in each, and then it was as I sent them out, a ton of people dropped out, or not, they had to go, but just so you know, some of the rooms shrunk, but for the most part, we have good, like at least 4 or 5 in several, and then a few of the rooms just closed out.
Yeah, I'm not surprised, because as I said, Charlotte, this is the wrong timing for the small groups, but it just had to do with when people could actually get here to do their presentations.
Yeah.
Yeah, I think that works. And I haven't checked the links, but I'm sure people add, and I let everyone know they can continue adding. So I don't know. I didn't tell anyone to cut off though, like by this time, but I just let them know they can continue adding to it.
That's great. Maybe put a note to the meeting saying it's 12:30. You're welcome to close, but we'll leave it open for another 15 minutes.
Yep.
People have conversations that they're still engaged with.
Should I leave the breakout room open 15 more minutes, or are you saying just the Jamboard?
I don't know, Charlotte, what do you think?
Looks like it wouldn't hurt to leave it open.
I mean, it doesn't hurt. I think we should be able, excuse me, that nagging cough. We should be able to see if people are still in there.
Okay.
Yeah.
So, like, it looks like, yeah, we still have quite a few people sitting in the breakout rooms.
So if you don't mind giving them that message, Maria.
And then Maria, I don't know if you had a chance to hear us, but if you pop back and forth through the rooms and you still have your recording on, every time you come back here, it says record stop. Recording started.
Yeah, it's funny. The recording follows me. And so I let people know when I go in the room, because some of them are like, oh, is this recorded? And I go, don't worry. As soon as I leave, the recording will follow me. Feel free to discuss. And they're like, oh, thank you. So that is funny. Oh, hi, Vivian.
Hi, Vivian.
So are people coming back to the space, or are they just in there?
It seems like people are popping in as they're leaving, but it's the meetings closed or adjourned, and
okay. Yeah. Well, I'm gonna keep writing my stuff in my Principal 1A thing because I have a lot to say. Okay, yay. Well, y'all have a
Thank you. Thank you for bringing your voice to this space. We really appreciate it.
Yeah, nice to be in space with y'all. Have a good day.
Thank you.
Angela, she's gone now. I was just gonna say two Angelas were on for a moment. I was just gonna say, Angela, I'm so glad to have Josephine Cowdy here.
Oh, sorry.
Annette, are you okay with me stepping away at this point? I actually have an inspection happening in my house now.
Charlotte, thank you so much for the very first time you facilitated one.
You did a fabulous job. Just absolutely remarkable. Megan and I were just chatting about what a great job you did.
Oh, thank you. I appreciate it. I don't normally get nervous, but I will say it's a large group and, you know, all such amazing souls. And so I had a little bit of nervous there.
No, you did a great job.
Thanks.
Yeah.
Oh, and Shanda, that's a good idea. Yes, I will do that. Shanda's asking me to share out the principles via email. Okay.
Looks like we saw.
Do you want the recording to continue? Or do you
Oh, good thing. Oh, yeah, I can stop that. Thanks, Linda.
Yeah.